The dose response curve is a pretty straightforward concept. Don't let it overwhelm you. It's just a graph of the magnitude of an effect by the amount of drug you take. Here's what it looks like. So dosage of the drug from low to high, and effect of the drug from low to high. And what it shows that at very low doses, there's very little effect. And then for a while, as you increase the dose, you get a commensurate increase in effect until a certain point where you plateau, where even when you increase the dose, you do not get an increase in effect. At this point, you have somehow saturated the body's ability to make use of this drug. We'll come back to that idea later. But the dose response curve, again, simply just a plot of dose by effect. Now that's simple. However, you know it's not going to stay as simple because drugs are complex and drugs have multiple effects, not just one effect. And each of these effects has a different dose response curve that falls at a different point, and some of them will have different slopes, but for the most part, they will follow this kind of pattern. Now, as a way to understand this, let's study morphine. Now, why is morphine used medically? Of course, pain, relief, do you know what else opiates are used for? Cough suppression. You young whippersnappers might know this as purple drank or lean. The rest of us know this as codeine plus cough syrup, dextromethorphan. Dextromethorphan. What other effects do opiates have? Well, they're anti-diarrheal. In fact, back in the day, it used to be used for diarrhea. Could you imagine today you have upset stomach and the doctor prescribes you morphine? Ah, why else do people take morphine? Of course, to get high. And this, we're talking about morphine, but this is all similar drugs. Now, how do opiates kill you? Respiratory depression. You stop breathing. Let's clear the screen. Let's look at these dose response curves. They've given us two. This is the dose response curve for the analgesic pain relieving effect. Analgesia is the relief of pain. Um, Algia is pain. Okay, let's look at the dose response curve for the pain relieving effects of morphine. You see, it starts here and it plateaus here. Now, if we look down, we see that the doses that are useful for pain are in this range, low to moderate. If I give you this much drug and I'm trying to treat your pain, that was a mistake because I could have given you this much for the exact same level of pain relief. Okay? So if I were to ask you, morphine used in a hospital under doctor supervision and exclusively for pain, would you say morphine is safe? I would say yes, because if we look at the death curve, this is the dose response curve for the respiratory depressive effect of opiates. Let's look at the doses where respiratory depression starts to kick in. So even at the highest levels effective for pain, I'm not really causing a significant amount of respiratory depression. So with all of my many caveats, in a hospital under doctor supervision, used exclusively for pain for short term, I'm talking 2 to 3 days. Is this safe? I'd say yes. The problem is the vast majority of opiates are used at home, not under a doctor's supervision, not in a hospital, and certainly not for short term. Now, there's another very important dose response curve that we should draw. That's the euphoria curve. The dose response curve for getting high. Where do you think that dose response curve is? Do you think it's close to the analgesia curve? Or would you think it's closer to the dangerous curve? Yeah. The euphoria curve is something like this. For the euphoric effect. So if you're taking opiates for euphoria, what range of doses are you using? And you see that you're in the danger zone. You're going to be getting some respiratory depression. Now, here's what makes a bad situation into a real nightmare situation, and it's tolerance. We'll talk about the mechanism of tolerance later, but what this is upon repeated use, need higher dose per same effect. Now, what do you think tolerance does to these dose response curves? Think about it. I say you need more and more drug to reach the same effect. If you're thinking all the curves move to the right, you're correct. But here's the problem. Big, big, big issue. Tolerance happens at different rates Okay, tolerance happens at different rates for different effects of a drug. So some of these curves move fast. And wouldn't you know it, the dangerous curve, the death curve, moves slowest. Even if you're taking these opiates for pain, after a long time, the dose response curve for the pain effects, pain relieving effects, get closer and closer to the death curve. Situation's even worse if you're taking these drugs for euphoria. You're already pushing it. Now, through tolerance, the curves become closer and closer and closer, so that now each and every time you're using, you are definitely getting some respiratory depression. In fact, if you ever see people use opiates, their breathing rate will go down dramatically, and it becomes slow and shallow breaths. Now, if we simplify this slide again, if you look at, you identify your desirable effect of the drug, which again is pain relief. Then you identify the dangerous, harmful effect of the drug, which in this case is respiratory depression. For Tylenol, by the way, the beneficial curve might be fever reduction or slight pain relief. What would this dangerous curve for Tylenol be? If anyone knows, liver damage, liver toxicity. The gap between the desirable dose response curve and the undesirable is your margin of safety. I think it's intuitive to understand that you want the margin to be as wide as possible. A situation like this is not desirable because the margin of safety is so small. So small. Margin of safety is important, especially if the chemical you're using is of unknown purity. If you don't know how potent your drug is, you expected this, but it was much more potent. That's an accidental overdose, right? You want this margin of safety to be as wide as possible so that the doses that help you are far lower than the doses that are going to harm you.